seconds and then start your speech. You can go live now.
Okay. Hello. Good afternoon, all of you. Good afternoon, doctors. On behalf of Hetero Healthcare, I, Dr. Prashant Khandeparkar, welcome you to this webinar on intimate hygiene. Doctor, at Hetero, as you all know, we market products in multiple therapy areas, like in gynecology, in dermatology, in orthopedics, gastroenterology, pulmonology, etc. We have a very strong R&D, and our endeavor is to develop products with patient benefit in mind, with patient compliance in mind, finally affecting the outcome favorably. Because unless the product is compliant and patient use it properly, we all know clinical outcome is affected. We have developed NSAID patches, reverse treatment patches for patient benefit, for patient compliance. Gynecology, obstetrics, and IVF is an important therapy segment for us at Frenza. And apart from oral tablets like Didropal and Milotin, we market products for vaginal health, Feminora and Pelitra. Recently, we have introduced a vaginal lactic acid formulation along with 2 oligosaccharides. This film, the formulation is in film form. The formulation is called as Celora. The film is supposed to correct the vaginal pH and maintain it at acidic pH so as to protect vagina from infections and so as to give good bacteria a chance. To speak more about the conditions requiring vaginal film and the product and share clinical experience, we have with us Dr. Veena Shinde. Dr. Veena Shinde is MD GGO from Mumbai University and postgraduate in ART. More than 25 years of experience, is consulting gynecologist in Shinde's Medicare Hospital. Madam has conducted several phase 3 and PMS studies and has participated in training programs and workshops. Madam has been faculty at both national and international conferences and has published several papers in journals of repute, both international and national. Over to you, Dr. Shinde.
Good afternoon, everybody. It is a warm afternoon and it's a very interesting and very challenging topic that we will be starting. Recent advances in intimate health management. Intimate hygiene is all about keeping your privates clean and hygienic. Daily gentle cleansing of the vulva is an important aspect of feminine hygiene and overall intimate health. The vaginal flora, it's a self-cleaning machine. Clear white vaginal discharges are normal and an indication that it is perfectly healthy. However, if the discharge is smelly, of a different color, like yellow or green, and is causing itching and soreness, chances are high that it might be due to an infection. The vaginal flora and vaginal pH plays a significant role in intimate hygiene. The uterus, the ovaries, the fallopian tubes, and the vagina. Vaginal flora, vaginal microbiota, or vaginal microbiome are the microorganisms that colonize the vagina. In healthy vagina, both good and bad bacteria coexist in balance. The primary bacteria of a healthy vagina are of the genus Lactobacillus. Lactobacillus protects against pathogenic species. The acidic pH of a healthy vagina ranges between 3.5 to 4.5. The increased acidity forms a natural protective shield to prevent harmful germs and other microorganisms from intruding. A pH above 4.5 makes the vagina susceptible to vaginitis or inflammation of the vaginal tissue. Lactic acid supports the maintenance and restoration of a naturally healthy vaginal flora. The vaginal pH is therefore determined by the sum total of lactic acid production by the vaginal mucosa and the microbial flora. A healthy vagina gives a balanced pH. Estrogen hormone acts on the vaginal mucosal membrane, releases glycogen, which converts to lactic acid in the presence of lactic acid bacteria. hampers the growth of pathogenic bacteria. Colonization of the lactic acid bacteria takes place, introduce the growth of lactobacilli, creates an acidic environment of a pH of 3 to 4.5, and it causes a natural protection system, preventing infection and maintaining vaginal health. Lactic acid produced hampers growth of pathogenic bacteria, colonizes more lactic acid bacteria, induces more lactobacilli growth, creating an acidic environment of a pH 3 to 4.5 and regularization of vaginal pH, preventing infection. The normal vaginal flora has an acidic vaginal pH and vaginal discharge are all components of innate defense mechanisms that protects against vulvovaginal infections. What is the pathophysiology of vaginal health? Risk factors are age, lifestyle, decreased intravaginal lactobacilli, H2O2 and lactic acid, decrease in concentration, raised vaginal pH, increase in overgrowth of pathogens, leading to vaginal infection, fishy vaginal discharge, and may lead to infertility and STDs. Menstrual cycle blood has a pH of 7.4. So during periods, pH is elevated. Most women bodies can handle the difference, but some find they are prone to infection during or after menstruation. Medication. Antibiotic medication can raise the vaginal pH because it kills all bacteria, good and bad. Birth control pills can also change the vaginal pH for some people, which potentially leads to infections. Douching is a method of cleaning inside of the vagina. It's different from washing the outside of your vaginal area with soap and water. Douching usually involves squirting a pre-packaged fluid mixture into the vagina with a tube or other tool. The process can raise the vaginal pH. Lubricants reduce dryness in the vaginal area during sex. Some lubricant products have a higher pH, sometimes higher than 4.5. The higher pH can kill the healthy bacteria and lead to infection. Breastfeeding or menopause. Hormones, especially estrogen, play a large part in keeping the vagina healthy and pH acidic. When women are breastfeeding or start menopause, estrogen levels are low, sometimes resulting in conditions like vaginal atrophy and causing higher pH. Some of these chemical preparations don't give long-lasting results. Lactic acid wash out even good bacteria, lack adherence to the vaginal surfaces. Suppositories, leakage issues due to use of high suppository bases and are inconvenient. Vaginal gels are messy applications, accurate drug delivery is not possible due to sticking of the gel on hands and applicator. Soft gelatin ovules are discomforting and due to the non-flexibility of the material. There is a need for a right therapy option for sustainable result in balancing the vaginal pH. Lactic acid vaginal films. They are longer residence time due to use of bioadhesive polymers, lack of leakage, patient comfortability due to film flexibility, easy storage, increased stability at the extreme storage conditions, faster drug release, convenient application. To bridge the therapy gap, a revolutionary therapy in vaginal care management to balance the pH. For the first time in India, Silero. Wow for a healthy vagina. Lactic acid restores the imbalance of vaginal microbiota, restores vaginal pH 3.8 to 5. Fructooligosaccharides promotes the growth of lactobacilli and secretes antibacterial substances, balances the vaginal pH. It's a lactic acid vaginal film, Silero, and it has a faster and accurate drug delivery system. There is longer adherence to the vaginal surface due to the bioadhesive polymers. It's a flexible film, ensures patient comfort, easy to carry, easy to use, easy to store. Patient should wash the hands, cut the pouch from 3 sides, roll the film between the dry fingers. In a comfortable position, insert the film into the vagina and then wash hands after insertion. Lactic acid vaginal film, one thin film at bedtime for 5 to 7 days. Thank you.
Thank you, madam. Thank you. Now, if there are any questions, you can please, doctors, any questions you can please write, send it to us. Madam, in the meantime, we have received some questions. I will
Yes, we
ask it
can
to you.
start.
Yes. Madam, when you actually prescribe the film, when the patient is susceptible or when the patient has actually got, infection, when do you actually prescribe?
When patients have history of repeated infections, they should be prescribed it before they get the infection.
They should be prescribed before they get the infection. Okay. How safe is intimate hygiene during early stages of pregnancy?
How safe is intimate hygiene?
Hygiene during early stages of pregnancy.
It is very safe.
And how long one can use it?
We can use it, see, 5 to 7 days is what is written, but you can use it for a longer duration also.
Now, for this intimate hygiene, is there any special ingredient which can give cooling and soothing effect?
Is there any special ingredient?
Yeah, which can give cooling and soothing effect is one question we have got.
See, it will not give cooling and soothing effect. It will avoid irritation.
Okay. Okay. And oral therapy is costly or vaginal film said it cost-wise?
Oral therapy is definitely costlier. And see, all the probiotics that they are promoting is for 3 months. This is
Okay.
only 5 to 7 days. So definitely the duration is also less.
Less. Is there any difference in this product and the one which has used OTCs, this film?
See, the difference is it is a film. So it is
It's a film.
bio-adherence will be better.
And probably the dose is also exact as compared to the gels which are available.
Right.
The dose also may not be, the use may not be proper. Madam,
Correct.
does this gel give any local irritation when they are used, the gels that are available commercially? Do they give any local irritation or they are
Not everybody is comfortable with the gels.
gel? Huh.
See, applying the gel is also not easy.
Not easy. Yeah, correct. And second thing, another thing, madam, another question. How do we diagnose bacterial vaginosis? Any lab test can help?
Yeah, you get a vaginal swab done, and in the vaginal swab, you get the different organisms, Gardnerella. Yeah.
The infecting organisms.
Right.
Now, madam, once you start prescribing once you start prescribing once you have prescribed the film, how do you know that the patient is responding? Is the symptoms less? Is the local effect more? I mean, what is the parameter by which you evaluate the patient is responding to the films?
There is no symptoms. Symptomatically, the patient is better. And there is no foul smell in the vagina.
Okay.
And if we do a test also, you don't get any organisms.
You don't get any organisms. So it's a proof that the patient is treating in a proper path.
Right.
And for how does it make any difference that you use the film at night or in the day?
No, it doesn't make any difference.
It doesn't make any difference. But for convenience, I suppose night time is more suggested.
Nothing like that. See, if people are using it in the day also, it is fine.
Okay. Okay. And patient experience, how easy it is to use?
It is very easy to use.
It's very easy to. Does it give any local irritation or any?
No, it doesn't give any local irritation.
I mean, it will not be needed, but can it be used during periods? It will not be needed because that's not the time that
it can be used in periods also.
Can be used.
Yes.
Okay. And suppose the patient is diagnosed bacterial vaginosis or whatever infection, and you're actively treating the patient with active treatment. Would you
patient can take oral medication along with vaginal?
That's it. That's it. This can be co-prescribed.
It will help the patient to recover faster.
It will help the patient to recover faster. And after, how soon do you suppose the patient is you are given the treatment for say 7 days or 5 days, whatever the patient has responded. The patient relapses maybe because of the predisposing condition. Patient relapses. How soon do you once again repeat the course?
Immediately.
Immediately. You can repeat the course even immediately.
Yes.
No such thing. And how long the effect remains?
How long?
I'll just give
if the patient is not exposed again, the effect will remain for a month.
Okay, if the patient is exposed, depending on the type of exposure and the severity of
Yes.
exposure, the infection will be less. That's right. I'll just see if there are any more questions.
It is very common in our country because of the moisture and the heat. That
Yeah.
is why it is very important.
Just a clinical finding, because this vaginitis can be caused by Gardnerella, Trichomonas, Candida. Does this film give any better effect in a particular type of infection, bacterial vaginosis or candidiasis or, trichomonal infection? Any such thing, or it's a general type of relief?
So it is a general thing. The lactobacilli will grow, so it will have a sustained and good effect.
Irrespective of the type of infection.
Yes.
Irrespective of the type or irrespective of the causative organism. And postmenopausal, obviously, when the estrogen level drops, the patient becomes more prone for infection.
See, that time you should use the Pelitra gel.
I was coming to that.
Why to use this?
I was coming to that.
They require lubrication.
Correct.
You can
And
use it. You can use it in menopausal women also.
If there is
Because
a signs of
sometimes they
infection.
also land up with infection.
Yes, because the protective effect will be less. And madam, how frequent it is, with broad spectrum antibiotics prescribed, how frequent it is for patient to get this superhead infection? Because we know patient
Once a year at least they land up with this side of it.
they land up with this. Okay.
Especially when they are out in the summers, when they have gone for their vacations, they always come back with infection. So you can give it to them. Suppose they are going for the water sports and all that. They can carry this with them and they can use it in the evenings so that they don't land up in infection. It can be given prophylactically to the
prophylactically. That's what I was coming to.
Post IUCD insertion, it can be given prophylactically. Post IVF also, we can give it prophylactically. See, because that time also, because of so much of manipulation, sometimes the IVF fails because of vaginal infection.
That's correct. In fact, in many of the IVFs initially,
so now the role of probiotics is very important.
Yes, correct. Because IVF, many of the time they use lactobacilli before they start the IVF to There's another question. How do we use it after delivery? Would it be needed?
After delivery, you can just roll it on the finger and insert in the vagina.
But why could we do it after delivery? I mean,
because they will be bleeding for 40 days. So because of the bleeding, there are chances that they develop infection in the vagina.
Okay.
You can use it post-delivery.
Okay.
If there is somebody who is diabetic, who is more prone to infection, they can use it. Because the menstrual blood does cause irritation sometimes.
Yeah. And would it interfere with episiotomy healing?
It will help the episiotomy healing. Why will it interfere?
Okay. That's another question I got.
Especially if there's been a 3rd degree perineal tear and all, it will be useful rather than being
obstructive. I think that is all we've got. Any other question, anyone?
Has anybody used the film? And what is your personal feedback to all of us? I have used it. I am very happy with it. That is why I am telling you that it is.
Anyone else would like to share the experience?
It's a very good product. See, I've always been using probiotics right from the time when Ecoflora came in the market. Okay. So over the years, over last 10 years, I have been using probiotics. And I feel they are really important. But this particular delivery system is very unique and very nice.
How do you compare this with probiotic vaginal pessaries? Probiotic vaginal pessaries are available, lactobacilli.
See, they are probiotic tablets, they are probiotic capsules. Yes. But I find the film better because adherence to the vaginal wall is better. It will not slip and fall.
Okay, as compared to the tablets.
Yeah.
Okay. Because there are intravaginal
And it is not harsh. It will not hurt also.
It
See,
will not-
tablet is hard, so it can hurt also sometimes.
It can give little irritation also.
Right.
But clinical effect wise, do you think there will be a difference? The probiotic.
See, when there was no film, we were using the tablet.
Yes. But you would prefer a film over tablet?
Yes.
Well, Meta, there's one more question coming. In follicular study, in some patient, there is a free fluid in pod. In that, it can be used, these films can be used in
I
follicular
don't think
studies.
we should use it for during ovulation. You should allow the nature to. You can use it post ovulation. After 2 days after the follicle has ruptured, after that you can use it. Let the fertile window be clean.
But not during.
No chemical should be used during the fertile window.
Because that's a very important case. We're receiving questions. This is the one we've got. There's one more coming. There is one feedback from one doctor. He says that I gave this product to one patient, but after that she did not turn up. So probably doctor feels she's got relieved and treated. One doctor is sharing his experience. That's good in that. Because the adherence would make a lot of difference in terms of patient relief. The adherence would make the drug stay for a longer period of time as compared to tablets, as you said. We'll just wait for a couple of. Any other questions, my dear doctors? Any other questions?
No question. Oh.
Another feedback, madam, we got. Film is a very novel idea. From some practicing doctor, he has used the product. He's saying film is a novel idea. Does this film help in reducing fungal infections?
Yes, it will help in reducing fungal infections.
Even for fungal infection, the pH would matter, no? Apart from bacterial.
The intensity of the infection will be less.
Intensity would be less, correct. The pH doesn't matter there also.
Yes. The fungus will not grow that proficiently because of the lactobacillus.
I suppose the most important fungus would be Candida, I suppose, there.
Yes.
Any other questions, doctor?
Not seen.
I think that's all, madam. That's
Okay.
all.
Thank you. Thank you
For
very
the
much.
questions, we will let you know. 1 minute, 1 minute. No other question. Thank you so much, madam. Thank you. It was wonderful. I hope the doctors, you have got your queries cleared. On behalf of Hetero Healthcare, madam, I thank you once again for your time. Thank you all the doctors for attending. Thank you. Just 1 minute. I suppose